Hi guys, welcome back. We shall be talking about oral contraception pills. We are talking about combined oral contraception pills. How does it work? Just to give you a brief overview. To understand this, you have to see again how does your menstrual cycle take place in the first place. So whenever we are having the brain is releasing an hormone that's known as FSH. This is known as follicular stimulating hormone. Now this is going to stimulate the hormones to grow and it's going to recruit the follicles. So we are having primordial follicles, around 3 to 4 lakhs of primordial follicles during puberty. Out of that, every month 1000 are recruited. Out of that 1000, 6 to 7 are recruited as an antral follicle, and out of that one becomes a dominant follicle. So you are having around 6 to 7 antral follicles. Okay, out of that one becomes a dominant follicle. Out of that one becomes a dominant follicle. Now remember, whenever the follicles are growing from antral follicle to dominant follicle, in this stage they are also producing a hormone that is known as estrogen. They are producing estrogen. How much? Around 150 to 200 picogram. Okay, now this thing is also producing estrogen. Now this estrogen is going to make the female all the female characteristics. This is also going to proliferate the endometrium of the uterus. Along with this is also going to give a signal to the brain in order to release another hormone that is known as LH. There is no luteinizing hormone. The function of this, it is a proteolytic enzyme type. So what it is going to do, the dominant follicle which is there, which is having the secondary oocyte, okay, it is going to make the lining thinner. It is made up of protein. It is going to make the lining thinner so that it can rupture and ovulation can take place. The secondary oocyte can come out. Okay, that is a function of LH. Now once this thing is done, ovulation has taken place. It takes on around 14 days. Okay, of 28-day cycle. 28-day cycle. If the cycle is 30 days, you don't have to worry. Whatever you have to do is that you have to go back 14 days. This 14 days fixed. Okay, so if it is a 30-day cycle, this means it will be on 16 days there will be ovulation. Okay, so that thing is fixed. Whatever the normal range of the menstrual cycle is, that subtract that number from 14. That is the day they will be having ovulation. That number is fixed. If 30-day cycle, I'll be subtracting 14. That is 16 day there will be ovulation. If it is 28-day cycle, I'll be subtracting 14. So I'll be getting 14 day only there is ovulation. So this fixed. Okay, now ovulation has taken place. Now remember, whenever the ovulation has taken place, there are two things happening here. Okay, I'll tell you this in the later part of the video. What is happening is that it is going there, it's like an explosion, it's like a trauma here. So there is trauma, so there will be blood accumulation here in this place. So what will happen is blood will go and trickle down in the pouch of Douglas and it will irritate that pouch of Douglas. So there will be a phenomenon known as mid-cycle pain. Why? Because it is irritating. So the female will complain on the day of ovulation, I'm having a pain on my right ovary, on the left ovary, because you know every month one ovary works, it is alternating. So she can say, okay, I'm having this, and after this, after that 14 days after this pain, I'm having periods. Okay, that is fixed. No, 14 days I told you is fixed ovulation, then 14 will be your date of the entire cycle. Okay, that is how you can find out when are you having your ovulation. Your entire cycle minus 14 days will give you the date of ovulation. So here you are having a pain that is known as mid-cycle pain. Along with this also you are having another phenomenon. Whenever there is a trauma here, it's like literally like an explosion. You will be having prostaglandin coming here. Now this prostaglandin, some will be deposited here, some will go in the uterus. I'll just tell you later about it. Will go and deposit in the uterus. Now this thing happens, the remaining follicles, the remaining antral follicles will shrink and will be converted to corpus luteum. It will become corpus luteum. What will corpus luteum will produce? Producing progesterone. Why do you need progesterone? In order to make the endometrium of the uterus secretory. This progesterone is going to make up the glands which are present in the endometrium, filled up with fluids. There will be glands will grow up. The secretion lining will become a bit more thicker. Along with this, the lining will be having more blood supply. In short, it is going to make sure the endometrium will be capable enough to produce and to nurture and not produce, to maintain a baby and supply the adequate amount of nutrition. That is done by the progesterone. This is known as secretory phase. And whenever this estrogen function is to make the endometrium in the first place, that is the proliferative phase. Now this is the entire menstrual cycle that has been explained in a very short manner. So you see FSH has to be there, LH has to be there, estrogen has to be there, and progesterone has to be there. These are the four things which is important. Now You can see in any endocrine, if anything goes down, the body will give signal to the brain there's something is less, I need to increase the amount. Or if something is moving the body is going to give signal to the brain, it is excess, let us make it down. So you see, this FSH is, you can say this FSH is somewhat related to this estrogen. That is, whenever the body is releasing FSH, this body is getting signaled by estrogen. Brain is releasing FSH. Now this FSH is released by brain. Now this brain is getting signaled by the coming back of estrogen. So you can write FSH, the main function of FSH is to release estrogen. Same goes here. The LH, you can see the LH main function is to do ovulation. While after the ovulation is done, what is going to happen is going to shrink. Shrink means corpus luteum. Corpus luteum means progesterone. So you can write LH is progesterone. So progesterone will give feedback to the brain to say stop production of LH. If I am having enough, this estrogen is going to give signal to the brain. If I am enough, stop producing FSH. That is the entire concept that I want you to understand. Okay, we have to understand this. Now, once we have understood this, again, now you have to remember. Now, why are we talking about this menstrual cycle so much while the chapter is oral contraception pills, combined oral contraception pills? Because now, what is we are doing in combined oral contraception pill? It's containing estrogen and progesterone both. Okay. Now, if we are giving estrogen from external source, this estrogen will go and give signal to the brain. I am having enough estrogen. There is no need to produce FSH. No FSH means no antral follicle selection. No antral follicles no dominant follicle will be produced. So, in that way, this oral contraception pill, the estrogen will be preventing you to develop the follicle in the first place. That is how contraception is attained. Okay. Along with this, whenever you are giving progesterone, now this progesterone will give a feedback to the brain to say, do not produce LH. I don't need LH. I don't need ovulation. I don't need the remaining follicles to shrink and become corpus and then to have progesterone. I'm already having progesterone. That is how progesterone is going to suppress the ovulation. Along with that, progesterone has another effect, that is progesterone can make the cervical mucus thick. The cervical mucus is thin at around 14 days. That is, it allows the sperm to enter the uterus very easily. But whenever you are giving the progesterone, it is going to make the cervical mucus thick. That is the reason progesterone is the hormone that is maintaining the pregnancy. So whenever you are pregnant, the body will not ovulate and you will not become pregnant because of this reason, that is the progesterone. Even if you have intercourse, there will be no ovulation. Along with there will be thick mucus plug. Maximum sperm cannot cross this mucus plug. Some can cross. Even if it crosses, there will be no ovulation. Then what? It will fertilize. The sperm will die in 3 days. Okay. That is the reason you see whenever you are pregnant, if you have intercourse, you will not have pregnancy. Okay, this is how this thing. So if we are giving estrogen progesterone from an external source, the entire system will shut down because the body is very smart. Why to make so much of hassle? The body will not be producing FSH, the body will not be producing a follicle, the body will not be producing dominant follicles, no LH will be there, no corpus luteum will be, no progesterone will be there. So entire these things are not there. So there will be no periods, right? Because there is no follicle, there is no estrogen, there is no endometrium proliferation, body's no estrogen is there, but there is no body's progesterone, so there will be no secretory endometrium. But the answer is yes, there will be periods. I understand there is no estrogen from the body that is going to proliferate the endometrium, no progesterone from the body that is going to make the endometrium secretory. But yes, we are giving you progesterone and estrogen from an external source. That estrogen is going to make the endometrium proliferate. That progesterone is going to make the endometrium secretory. Remember, whenever we are giving you estrogen, we are giving you the least possible dose of estrogen just to suppress the FSH. That means a person who is taking oral contraception pills, they are going to have less amount of estrogen as compared to a person who is not taking oral contraception pills. Okay, so that is what. So that is the reason. And as I told you here, whenever there is no ovulation means there will be no blood, so there will be no mid-cycle pain. Along with this, there will be no prostaglandin that is going and deposited in the uterus. Okay, this is the uterus. Imagine whenever the progesterone level drops, this endometrial lining will shed out. Okay, it has to come out from the uterus. How it will come out? Because cervix is closed here, it has to contract. How will it contract? It will be contracted by a thing that is known as prostaglandin. As I told you, this prostaglandin which was produced here will go and deposit here. This prostaglandin will be contracting here. So there is no ovulation here, there is no prostaglandin, so it will be also be helpful a women who is having abdominal cramps, dysmenorrhea. This oral contraception pills will help her in that way. So you can see there are a lot of advantages. So remember, whenever we are giving oral contraception pills, we are making you anovulatory. Anovulatory means there is no ovulation. No ovulation means no mid-cycle pain, and there will be no prostaglandin release. No prostaglandin release means there will be no contraction, severe contraction as compared to normal, so there will be less abdominal pain. So anovulatory cycles are painless, okay, and ovulatory cycles are painful. How painful? There will be 2 times pain in the mid-cycle pain, okay, here there will be pain, and whenever there is contraction there will be pain. So there will be 2 times pain in ovulatory cycle, and ovulatory cycles are painless, ovulatory painful. This will be painful, and this painful will be 2 times mid-cycle pain and during periods. We say abdominal cramp also, okay. So that is the entire thing you have to understand. So even if we are giving estrogen, progesterone, yes, there will be periods. So what are the advantages now? Advantage here is, again, we can make the cycles regular. Yes, if somebody's estrogen, progesterone cycles are not, it is not adequately released, on some problem is there, okay. If the progesterone does not withdraw, or there is no enough progesterone, or there is no estrogen, so if we give this, we can make the cycles regular. Along with this, we can help in dysmenorrhea. Along with that, we can avoid the contraception in the first place, okay. Along with this, we can reduce the bleeding, because there's less amount of estrogen already by giving oral contraception pill. Less amount of estrogen means less amount of proliferation. Less amount of proliferation means less amount of bleeding. Less amount of bleeding means less severe will be the anemia. It can be help in anemia as well. And whenever you give oral contraception pills, yes, there is one side effect, that there can be chance of increase carcinoma of cervix, that is adenocarcinoma. That risk is minimal, but there is some chance. Along with this, you have a bit more chance of developing gallstones, a bit more chance of hepatic adenoma. These are the chances that can go up a bit. Along with this, you have to remember there will be no change in breast carcinoma, because we are already giving you less amount of estrogen in the oral contraception pills. A patient who is taking oral contraception pills, she is already having less amount of estrogen, whereas you compare a normal person who is not taking oral contraception pills, her level of estrogen will be more as compared to this. So there will be no change in that, okay. So this is the entire thing about here. And what are the advantage? There will be less chance of endometrial carcinoma, less chance of bleeding, less chance of pain, less chance of ovarian cysts, less chance of carcinoma of colon. So these are the advantages of OCPs, and there are some contraindication of OCPs as well. If you are already having breast carcinoma, you are already having dyslipidemia, you are already breastfeeding your child, because if you are having breastfeeding child, this OCPs can make your glands proliferate more, and it can suppress your ducts in your breast, and it will stop the production of milk. Along with this, if you are having some liver disorders, because this estrogen is metabolized in the liver. Along with this, if you are having uncontrolled hypertension and uncontrolled diabetes, oh my god, this uncontrolled hypertension, you can put in almost all the disease. It's a problem. Along with this, if you're having a chance of deep vein thrombosis, then we cannot give you oral contraception pills. So this is the entire thing about oral contraception pills, and how does it work, and how does it help us to avoid the pregnancy in the first place to take place. That's all, and I'll see you in the next video. Thank you.